The Lambeth GP Food Co-op is a community-led cooperative of patients, doctors, nurses and Lambeth residents who grow food together. We work in partnership with GPs across the borough, building gardens in GP surgeries and developing unused spaces for food growing purposes. We have built 11 food growing gardens in GP surgeries where patients are actively involved in growing food together, including a garden in King's College Hospital where we have a monthly stall selling patient-grown food. We were awarded the Best Sustainable Food Initiative in the NHS by Public Health England and the NHS Sustainability Unit.
It got started from a conversation with GPs, patients and nurses located in Lambeth who were interested in whether we could create a network of food growing gardens across general practice in Lambeth. We were fortunate enough to attract support from Lambeth Council. We also have a very forward-looking and visionary clinical commissioning group in Lambeth who also funded us to get the Lambeth GP Food Co-op up and running. We have a community across the borough who are involved in different activities interlinked around food, diet and nutrition. The aim of this project is to influence food procurement. It's one of the aims in the NHS. We have 60 hospitals in the M25 corridor. Not one of them buys anything grown locally. We're looking at this one as having an economic context as well as a therapeutic context.
Being part of the food co-op is part of a much bigger ambition that we have, which is really trying to melt away the walls of the surgery and become a much more open building or place for the community where they can come and have access to health and well-being.
The kind of patients that I recommend coming to the garden are people who may be a little bit isolated, maybe they have depression, low mood, other mental health problems that make it difficult for them to get out.
Those with long-term conditions or who are socially isolated, or anybody actually who was interested in keeping fit in another way and meeting other people in the group.
My name is Lil Sullivan. I'm an artist and a singer-songwriter and a stroke survivor. I heard about it in the doctor's surgery. It's nice to go to Brixton and see all the different people. I'd like to do the portraits of all of them. They're so interesting.
I like gardening. I like to be outside sometime doing things. Like to get my hand dirty.
I like that the gardening group is meeting people and they're very friendly and easygoing and there's no pressure.
We're bringing back some of the key values of the NHS back into this garden, and those values are around mutuality, support, learning and cooperating together.
So you can see how wonderful it was. This was like a bare concrete before, so you can see how much it's changed. It's got a little oasis.
The small ones, I'm planting them back. And then I'm covering them with the earth. And I'll always have potatoes.
I just like to talk. It's just lovely to go to a place where you can have an audience and you can do something as well. I don't like going to coffee mornings or things like that. I have to do something that is constructive, and doing the gardening is constructive.
Well, I think it's a good project because, as they say, the social, you get like a good social life. Everybody's friendly, they treat you good, and I just think it's an amazing project, really. I mean, I have fun. I even bring my grandchildren here sometime, and they enjoy it. So I think it's really, really good for them. It's good for the soul. It's good.
So in the future, as time goes by, we'll see how we can manage.
I'd like to see more funding and more people coming to the gardening classes.
Because we then see those patients less often in our clinics, we think this is a good way of patients to keep well.
It's helped me a lot, so I'm thinking that a lot more people should get involved in it and see what we do.
I feel good as a doctor because it's something other than medicines that I can prescribe, and I have only seen positive benefits in the people who have come here. So one patient told me that her blood pressure was much more controlled since she'd been coming to the garden project. And thinking of other patients, I've actually seen less of them, which surely must be a good sign.
It's really about creating a new sort of environment which promotes health and well-being rather than just having it all in my room.